I'm going to talk about the application of ice massage as a modality. Um, in general, cryotherapy, there's a few goals that include like the hemodynamics and edema control, um, neuromuscular responses such as altering hypertonic muscles and hypotonic muscles, and then also altering the metabolic effects and anti-inflammatory effects of ice. But ice massage specifically, um, some primary indications for it as a cryotherapy technique is to control inflammation, reduce the perception of pain, control swelling, and it can be used to treat both a hypertonic muscle and a hypotonic muscle. If we're going to treat the hypertonic muscle um, and we want to decrease the hypertonicity, then we're going to apply a sustained length of the cryotherapy treatment. And if we want to increase the tone in a muscle, such as a hypotonic muscle, then we are going to apply a quick icing technique or a shorter duration. And then keep in mind one of the main benefits of using ice massage as a cryotherapy modality is the fact that it can be used to treat a very specific, precise location, superficial on the skin. Since we apply directly to the skin, we can pretty much pinpoint any tender spots that the patient might have. Contraindications and precautions for the application of ice massage. We do not want to apply, or we want to be cautious with patients that have a low cold tolerance or hypersensitivity to cold. So we also want to look out for Raynaud's phenomenon. So just making sure that the hands and feet don't have any signs of pallor or cyanosis as a result of vascular vasospasms from the cold treatment. And then another thing is cryoglobulinemia. That's a mouthful, but we do not want to perform ice massage on over any regenerating nerves. And then no ice massage with patients who have a history of severe peripheral vascular disease, and any patients with altered sensation or cognition. And prior to our application, we always want to assess the patient's sensation and cognition prior to the treatment. So the actual application of the modality, we are going to screen for the contraindications and any precautions. And then we're going to properly position the patient for comfort and for us as PTs to be able to access our treatment site. So for an example, like a patient with lateral epicondylitis, I would maybe just have them sitting next to me on the treatment table with their arm positioned like this, or maybe a pillow underneath to prop it up. And then I'm going to explain the treatment to the patient and what they should feel during the treatment. So I'm going to tell the patient that they're going to experience an intense feeling of cold, and then it's going to turn into kind of like a burning feeling, and then it will transition into an aching feeling, and then finally they'll get to the point where they won't really have any feeling in the area at all, and that's pretty much the goal of the ice massage. And then to apply the ice massage, we're going to a little cup here. So you can fill the cup up with water, and then you can cut out the bottom, and then that will expose the ice through the bottom of the cup, and then we can just use the ice to apply directly to the tender spot on the patient. So we're going to, so for my example, the lateral epicondylitis example, I thought this would be a good treatment just due to its like the common extensor origin. It's pretty superficial here at the elbow. So I'd have my cup with the ice, and then any tender place, any sort of pain they're having down through the origins of the extensor tendons, we're just going to massage it with the bottom of the ice, directly with the ice coming out of the bottom of the cup. And then we're going to do that for about 6 to 8 minutes, or until the patient has that feeling of analgesia. Then you're also going to need a towel as well, because with the ice being exposed directly on the skin, it's going to result in a lot of excess water in the treatment area. So we just want to periodically wipe away the water as we're treating the patient. Other considerations, we don't have to really worry about remembering to check on the skin with this cryotherapy treatment, because we're with the patient the entire time, so we'll be checking them nonstop. And then other interventions that could be used for this treatment goal, you could either use an ice pack or a cold pack on the area. And then if you're looking for a treatment with more compression and ice, the effects of compression and cold, then you're going to want to go with something more like a cryocuff or a Game Ready.